Hello everyone. So welcome to Red Easy, and today I'm going to share with you how we radiological professionals can train ourselves in the various modalities of the radiology, where we can know about the various features which we are working, and also have the online trainings regarding the softwares. So this is launched by the Siemens PEP Connect, where we have the virtual training programs for the staffs. So what we have to do is first you get a register to the account. So already I am been registered. So like this, we will be opening the sites. Next, you have to click here and do the login. So in the login, we have to put your email ID and the password which you have registered. Next, it will be showing you the top education sites like this. Experiences will be there. These programs can be done by digital healthcare service, general healthcare, laboratory, BMLT, medical imaging therapist, molecular diagnostic, and patient experience. So they were training. So as I'm from the imaging field, so then we will connect to the PP Connect. So there are like what are the activities I'm doing? I will click on. I will show my activities. These are the groups which I am linked, and I'm training the programs. These are the plans which I will be completing by the sessions. Like this, all I have to go and I'll do the programs. Then this will be the groups, which groups has connected me. And so I'll tell you what we have to do. So you have to go to the educational catalog to complete the modules, points of care, diagnostic, patient experience. So I'm taking the imaging. So after this thing, the page will open. The portal. See, now I can do my training regarding medical imaging on the advanced imaging softwares, angiography, academic healthcare, CT scan, digital marketing, mammography, radiography, ultrasound. So if I am taking a mammography, there are Singovi mammography softwares will be there, clinical applications where we can come across the mammography contents like as the equipments I will be getting trained, image procedure, patient care procedure, safety aids. So like this, it will be showing. Okay. So if I'm going to the dose reduction, I want to do this training. So the module will open like this: mammography basic dose reduction and imaging technique. So this will be a 30 minutes program. First, I have to do add. So this will come to my plan. This is the thing I'm going to do. So the date will be um, after this. I have to launch. So once I'm launching, now I'm ready to go on with the modules. So like this way we can train ourselves in CT, mammography, ultrasound, patient care for the radiology purpose. Now look, if we are going for all this via valuated courses,
Welcome to this web-based training on mammography basics in dose and image quality. This course will be presented by Dr. Joseph Loeb, Associate Professor of Radiology and Biomedical Engineering and Faculty of Medical Physics at Duke University Medical Center.
so like this, we can train all the modules, and there will be a table content. So table content will say like what are the things as this particular validated course will guide us. There will be backgrounds, radiographic technique and doses, image formations, image quality, and then there will be an assessment exam. So 80% marks are required to come across the assessment exam. I will be doing one module in front of you today, and I will tell you how to go on with this. So this is very important for our career perspectives, because if we are going to launch a special software programs, validated programs, that is very much costly. It will be costing around 5,000, 10,000 rupees, which is not affordable to us. But we can go to the Siemens Healthineer and we can do it these modules in a very free of cost. They are providing all these trainings in the free of cost. So next, course objective.
For this module, we will learn about why is it so important to have high quality in mammography, why use molly at low energies for screen film mammo, what are the radiographic technique choices available, and how does technique affect image quality and dose.
So this all training programs as a course objective will say like this particular topic which I have selected right now, mammography basic dose reduction techniques, how it is going to help mammography in dose reductions. They have the Siemens Healthineer have a highly advanced training programs regarding the patients and staff upgradation of the skills. So with this all small trainings we can be upgrading ourselves and we can become trained. So as I always say, we if you are using an iPhone or an Android phone, you should know the features. Both the phones have different features. The more you are skilled, the more you are mastered in the machines, the more the companies will accept. This is what the HR wants: experience, skill, and knowledge.
The outline of this module is first we will cover some background, then we will talk about radiographic technique and dose, image formation, and finally, image quality. So first we're going to cover some background for mammography.
So you can see in the corner it is showing 329 and all. So these are the panels as the entire topics has. So it's a very interesting modules which I always suggest my students.
Consider this mammogram, which is admittedly a pretty poor one. Pop quiz. When do you think this film was taken? Was it the 50s, the 60s, the 70s?
So just click on the three dots and go for the desktop site for the good experience of the mammography. So you see here.
Consider this mammogram, which is admittedly a pretty poor one. Pop quiz. When do you think this film was taken? Was it the 50s, the 60s, the 70s, or the 80s? Well, you might be surprised to know that this was actually done by Stafford Warren all the way back in 1939. I show this image because while we might all agree that this is a fairly poor mammogram by today's standards, the state-of-the-art for mammography really has not changed that much in the 70-plus years since this image was first taken. Here are some images from the earlier days of mammography. This shows the first CC view. This shows a true lateral view taken with obviously non-dedicated equipment. And once again, you might be surprised to know that we've had these steps from courtesy of Raoul de Born back in 1951. In fact, it wasn't until 1969 before we had the first dedicated mammography system. The CGR sonograph is shown here, as well as some of the images taken with that system. You might recognize the name of that company because it was later acquired by GE Medical Systems.
So like this, they will train you in the short videos. You have to cross all the modules one after another. So I hope now you understand how much this is very important, and this will help you regarding the training purpose. This is all very, I personally am doing training from here and I'm presenting myself. Very frankly to speak, this all programs are free of cost, and the educative learners, the students especially, can have your times regarding all these things. Complete the modules and you will know worst of the field. That's up to you. The more you are trained, the more you are skilled. Again, I'm saying you are HR's favorites.
So briefly, let's talk about the characteristics of mammography. Mammography is very good in several ways. First of all, it has been shown to reduce breast cancer mortality. As a result, it is the most widespread screening tool for the early detection of breast cancer. Part of the reason for this is because of its low cost, its very high spatial resolution, its high speed, both in terms of the acquisition as well as the diagnosis, and finally, the fact that it can do all of this at an acceptable cost. However, mammography is not without its limitations. First, there's the problem of false negatives. Mammography misses 30 to 50% or more of cancers on the initial mammogram. This is due to the problem of overlapping dense tissue, since the mammogram is a 2D representation of a three-dimensional organ. There's also a problem caused by the limited contrast or the subtle findings of the lesions that you are trying to detect. Moreover, mammography also has a problem with false positives. This is due in part to the low incidence of cancer. As you may know, 1 out of 7 cases. So now that we have finished the this slide summarizes the process of how to make X-rays. The X Once you have generated the X-rays and irradiate the patient, one of three possible interactions will take place. The type of X-ray interaction when it enters the body is very important because this determines patient dose. So let's revisit our learning points that we showed at the beginning of this module, where we asked, why is it so important to have high quality mammo? Why use moly at low energies for screen film mammo? What are the radiographic technique choices available? And how does technique affect image quality and dose?
So well, just give all the videos. Just like this, you can click all the videos and you can complete the modules. Once you complete the modules, next will be the very important thing to grab the certificates. So there will be question rounds. They will put some times, like you have to attempt 3 questions. So let's start. Just click on the assessment, start. Now it came. What percentage of false negatives in mammography produces images? If I'm putting the answer 30 to 40. Next, you have to click. So there will be 20 questions, one after another, and you have to, how much we have to score? We have to score approximately, okay. Brainstem radiation is called as continuous X-ray spectrum. So what is the purpose of brainstem radiation? It is going to produce, what are the two characteristics of photoelectric effect? So like this, we have to attempt all the questions. So once we attempt all the questions, so there will be total three attempts to be permitted, and once we complete, automatically there will be the certificate. So like this, we will complete all the modules and we will go on. So I'll just skip from here now. So after completion of the modules which we want to see, like there will be CT, as I have taken an example of X-rays. So we will get so many varieties like this. Okay, so like this we can go to again. One second, I just mess it out. We will go educational catalog, imaging modalities, and then we can plan. See, I have planned for the mammography. So it is showing now that my this training programs is 16% complete, 0% complete. So these are the plannings which I have kept. My activities, how I am doing my groups, which we are going on, and finally we will have the transcript. So transcript will show, see, once you complete the module, it will show on which day you have completed the module, and there will be the certificate. Just click on view certificate, it will show print, and it's very good. See, download. So this is a certificate will be generated on your name. So we have done an online training program. The topic is transducer formation and functions, and that's, we have to go back. So after completion of this, if you want to, like for the CVs, all the certificates, this is the programs which I have done. So what I will do, I will do the export transcript. So once I'm doing the export transcript, this is going to show me, see, Ms. Sarbari Saha. So under my name, on which we are 2023, I'm doing it from 2020. What are the activities I have done? So external activities, online activities. So these are all the programs which I have done. I will upload everything and this will make my performer. So that's all regarding the PP Connect. I hope you have liked the sessions, and don't forget to like, share and subscribe. Share it to the radiology family, MLT, and the patient care regarding health, allied health science professionals, doctors. Everyone can use this. Healthcare providers can use this app to know about more and more use of the equipments in an easy and easy way. It's a very good app regarding the radiology peoples. They can do their online trainings. They will get certifications, transports, which transcripts, machine modality based programs and trainings. You can see here, as per the modalities, also you can train yourself. Just go. See, I'll show you. Like you will go to the medical imaging, and suppose now I am going to be working under the these are the softwares which we have. Now I'll show you basically with the help of CT. So I'll go to the CT. So these are the machines under the Siemens. Now I have got Somatom Drive, Somatom Go. So I'll go to Somatom Drive first. So this is the model I'm working. My hospital is working. So this Somatom Drive will help us regarding all the protocols is present here regarding that particular machine, image productions, procedural cleaning, safety, job aids, everything will be there. So you can get yourself trained on the particular software that is Somatrum Drive. Somatrum Drive is the software of the CT scan machine. You will be trained. So like this, we can train, get yourself upskilled. People will welcome you. HR likes the what is the code? HR likes the skilled persons. So this is how we can train. Till then, stay safe, stay good. It's Red Easy, RU Learning Academy, where radiology, anatomy, everything will be made very easy and clear for you.